Welcome, everybody. It is the 3rd of April. Hopefully, you guys got to pull some good April Fool's Day jokes on your friends and family. That's always fun. And hopefully, your weather's getting better. Ours is getting nice here in Minnesota. It's starting to perk up a little bit. We just have one question that came in this week that I wanted to address. It was a question about THC and CBD. So we're talking about the use of medicinal marijuana when we talk about THC and CBD. THC, of course, is the psychoactive component of the marijuana or hemp, and CBD is the non-psychoactive component. They contain cannabinoids. That's the technical term. There's over 100 different types of cannabinoids, and cannabinoids are not solely found in marijuana and hemp plants. They're found in other vegetables as well. There's numerous different cannabinoid receptors that have been discovered on cell membranes and neurons and all sorts of different cells that have all sorts of different actions and functions that are far from just the psychoactive component that so many people are interested in when they talk about legalizing marijuana use. So matter of fact, I just did a blog post just recently on the main different cannabinoid receptors and what they do. So make sure you look at our blog posts. I'm doing a lot more writing and blogging lately, so there's a lot of information on our blog posts about a lot of different things. So make sure that you're looking at that on our website too. That's on the resources page of our website. And you'll find a lot of interesting information, hopefully, there. So, how would a cancer patient use THC or CBD? Well, a number of years ago, I would say that THC is the component that would be used to help kill cancer cells, and CBD would have other medicinal purposes. However, recently, within the last 2 years, there's just dozens of studies coming out on CBD's effect on cancer and its beneficial effects to help kill cancer cells as well. So things are changing as studies are coming up. Interesting to note, I did have a patient tell me the other day that her oncologist said that he would gladly use CBD or THC if there was any studies on it, but there's just no studies on it. Well, all the layperson would have to do is go to Google and do a Google Scholar or a PubMed search for THC in cancer or CBD in cancer, and you will find literally hundreds of studies, and literally every one of them show its efficacy for cancer. I have yet to see a study that say CBD does not help cancer patients. Some way or another, it can help cancer patients, at least in all the studies that have been performed. So just for a doctor to say that he has yet to see any studies, he has yet to look, he's probably yet to read a published journal article since he graduated from school. No offense, but that's typically the scenario that these people find themselves in. They're not looking at recent literature. So yes, when I graduated 30 some years ago, there were no studies on THC or CBD in cancer. Now there's literally hundreds. So let's talk about the different uses of THC and CBD. So CBD is becoming more and more available. It's legal in all the states to use. We sell it on our store. There's good and better and best as far as CBD products that are out there. Maybe I should say there's poor, there's good, there's better, and there's best. There's a lot of really cruddy CBD products. One of the things that you have to be careful with CBD and THC is its purity, because hemp is a wonderful plant to clean the soil. It cleans the soil by sucking up all these bad particles into the plant. And not using an organic CBD or THC product can lead you to basically toxifying yourself. So you want to make sure it's organic. Um, I know we just talked about this on a Zoom call a few weeks ago, but these questions come in again. So the other challenge that I give you is to make sure that we want to be available to answer all these questions as they come up, but make sure you go through the past Zoom call videos, because I go into much more detail and some other things that I'm not going to get into tonight about the other values of water soluble CBD, nanoized CBD, and the other values of THC. Now, THC we can't legally sell in Minnesota. We don't have that on our website. You won't be able to buy that um, except through some people that are trying to get it in the hands of cancer patients. And if you do desire to have some THC product, we can give you the names of places that you could get it from, but we can't sell that. So THC and CBD both have great efficacy for cancers. And they should be, THC should be used very carefully because it's psychoactive and it can have a lot of side effects. CBD, you don't necessarily need to use that quote unquote carefully. You should always start with a smaller dose and work up. You should get a pure product, but it's not going to have any major side effects in a person, other than maybe a little bit of drowsiness, which it can actually really help. If you take it before bed, it can help you with sleep. So CBD has all sorts of other wonderful benefits outside of cancer, um, from a medicinal purpose, that it really makes it a valuable product for people. Okay, I'm going to open it up for questions that you might have. So let's see if we can get some participation here.
Dr. Connors, I have a question.
Uh-huh.
This is Donna from Arkansas. When I've got some CBD oil that I've been putting on my knees because I've been having a lot of extreme pain in my knees, and I've gone to the chiropractor, and I spent 2 months going 2 to 3 times a week, and it was didn't really help. And
so you went because of the pain in your knees? Is that what you said?
Yes.
Okay.
Yes. And she really wasn't able to help me. I mean, she took some low dose x-rays, and so it's not a cartilage thing. We think it's nerves, possibly from the cancer. So my question is, on the CBD oil, the kind I have, you can take it either internally, or it's like a cream. You can take it internally, or you can just rub it on. And I didn't know if you knew which would be best.
So let's say you have pain in both knees, is that right?
Yeah, it was the weirdest thing. I mean, I had no pain all these years, and then all of a sudden, the inside of both knees at the same time started having problems. And
Okay.
now, it's been almost a year, and now it's radiating down into my ankles.
Okay. Okay, so if it is from the cancer, um, it would really do you little to no good to put the CBD at the site of the pain there.
Okay.
Because the chance that you would have metastasis to both knees in the same spot at the same time is about 0.
Correct.
So, but you could have referred pain from, okay, the knees are innervated by your third lumbar nerve. So
Okay.
if you have some metastasis to the lumbar spine, you could get referred pain down both sides, especially if it's centrally located metastasis. You could get referred pain down both nerve pathways and feel pain down at the receptor area, which is down at your knees. But then putting a lotion or anything else locally is not going to do anything. You have to go to the site of the problem, which would be then you would put, if you wanted to use it as a topical, then you would put it at about the fourth lumbar area.
Oh,
which
okay.
is in your low back. So that's where you would apply it.
Right.
Um, and that could be beneficial. It can be anti-inflammatory, and that would help with the inflammation there, which is really what's causing the pain.
Right.
Um,
Right.
taking it orally also. Now, does CBD, is that good for pain? Taking it orally? Yes, it can be. Different people react to it differently, but typically you need a fairly high dose for it to really make a difference with pain.
Oh, okay. Yeah.
So I don't know the dosage of the product that you're taking. Um, so you'd want to look at that also.
Yeah. It's a good product and it is organic.
Okay, good. Well, then you'd wanna start with a smaller dose, maybe. And I would still say you have to start with at least 30 milligrams a day, and then bump up from there to see if it makes a difference
Hmm.
orally, um, to see if
So
it's going
several
to make a
times.
difference. Yep, I
Took
would
it on
say take it several times a day.
Okay.
Um, so she did took X-rays of both your knees, and she didn't see any degeneration or decrease in joint space.
No, it's more of a nerve thing. And I've had problems since I've been diagnosed with, really before I was diagnosed with cancer, with having nerve, white hot pain,
Uh-huh.
in my legs and in my arm, that lasts probably about 10 minutes. It's the most excruciating pain I've ever experienced in my life. Um, but it goes
So
away.
it
And
lasts
then,
about 10 minutes and goes away.
yeah, it goes away, and then it'll be a long time before it comes back and does it again. And I'm thinking it's maybe the way I'm sitting, you know, um, maybe that's causing it. I don't know, but
Yeah, I
um,
would say that and so how often is it happening now?
the last time well, let's see, it happened last, no, it was a couple of years ago, and then I had it again probably about 6 weeks ago. So it's real sporadic.
Okay. And then it only lasts about 10 minutes.
Yeah, but that's 10 minutes of absolute hell. I mean,
Yeah.
literally. I
Yeah,
mean,
so I
uh,
would say that yeah, that's probably a nerve inflammation issue.
uh-huh.
And you'd have to dig a little bit to figure out where it's coming from. It could be as high as in the brain. So
Wow.
especially if you're getting it in the hands and the legs, then it has to be from the parietal lobe.
Yeah.
Then that's where CBD can be beneficial for that.
Okay.
But that would be taking it orally.
Okay. Um, Now, Arkansas has passed a law now that THC is legal in our state. We haven't really set up anything. They're still in the process of getting all the clinics, set up for it. So it's not available as of right now. But
Uh-huh.
I'm wondering if that would help the pain. But I don't want to smoke it. I don't want to have a lung issue on top of everything.
Right. If a person has chronic pain, so not this intermittent sharp pain, but if a person had chronic pain where it's just maybe a grade 6, 7 all the time, or 8, 9 or higher all the time, that's where smoking marijuana can really be beneficial. And we've even seen people get off their opioids by doing that. And it doesn't have to be smoking. You could actually take it in a a cookie or something like that, as long as it's baked, so you could get the THC out of it. But it will make you feel a little loopy. And
Right.
some people don't like the way that feels, but it can be extremely beneficial for pain. And it seems to, at least on our experience, it seems to work better for those who have never or rarely ever used marijuana in their life. People that have used marijuana in the past quite extensively and then maybe haven't for 20 years, it seems not to work as well for them.
Yeah, that's not me.
because their CBD receptors are already upregulated. But people that have not used it, I've had people where they choose to smoke it, and they'll just take one puff, literally one puff a day, and that can knock their pain down to manageable levels.
Okay.
So that's an option too. Taking THC in a very concentrated form, what you would use for like killing cancer, uh, aka Rick Simpson oil, that will make you feel really loopy. That's, I mean, really, most that can put you out of commission for sure. So I would not
Okay.
recommend that unless you had serious chronic pain.
Yeah, no, I mean, I don't even take anything for it unless it gets really bad. I'll take some turmeric as well as once in a while I'll have to take an aspirin, just to help the pain because um, we have a business and like today I was up and down off of a 1-ton flatbed truck all day. And that definitely hurts my knees.
Yeah,
So
that could be hard on. I would really, if you have it in both knees, I
yeah,
would consider doing it on your low back. Now,
okay,
that being said, I'm not questioning your chiropractor and her X-ray skills. The medial meniscus of the knees, that's that inside part of the knee where you said you have where the
yes,
pain is. It
yes,
is the most common area for degenerative arthritis.
huh,
So that would be actually quite common for a person to come in and say, I have pain on the inside of both my knees, and it's degenerative arthritis.
hmm,
And if that's the case, then using something topically can be beneficial. And I always think of curcumin also because it's an anti-inflammatory, and boswellia and ginger
yeah,
and stinging nettles. Those are all good anti-inflammatories too.
yeah, yeah. I'm taking your Q clear
Okay.
twice
Yep.
a day. Yeah. Um. So, all
And
right,
if it is a degenerative joint, then think of also glucosamine and chondroitin.
right. I don't think so because it moves around my knee. I mean, my knee area. Sometimes it's in the front. Most of the time, it's on the inside of both. But it can be anywhere in the back, on the outside. I
Well,
mean,
that's not uncommon for degenerative arthritis, though.
okay,
So that wouldn't be an uncommon finding.
all right, very good. Well, I thank you very much. And
Oh, you bet. Here's
okay,
another question came in the chat. When reducing the dosage of CBD, is it necessary to gradually reduce the dosage, or could you do it all at once? If it's CBD or THC, you could literally go off of it all at once. So if you were wanting to get off of it for whatever reason, you could just stop. There's no need to reduce the dosage. Um, Going cold turkey on it is fine. You're not going to have any issues on it. Okay, any other questions? No? Well, thank you for being on tonight. Sorry about my voice. I can't talk today. And got this little crud that's going around, and hopefully I'll be better by next week. And I just will be praying for everybody and wish you all the best. We'll talk soon.
very good. Thank you. We're praying for you too.
Thank you. Bye bye.
Thank you, Dr. Connor.
Oh, you bet.
Love and best wishes to you.
Oh, you too, Liz. Bye bye.
Bye-bye.